Hiya, I'm Danielle James. I currently have nine nine different roles within my school. So I range from assistant Senko, pastoral lead, mental health lead, attendance lead, HLTA, sound trade therapist, drawing and talking therapist, ELSA practitioner, and anything else they ask me to do. So I have lots of experience across the school. I'm DDSL as well. My journey began way back when I was asked to do the ELSA practitioner training. And from there, my passion for mental health started to grow because I could see there were gaps within what our school currently offered. And I felt I wanted some more knowledge and some more support around how I could make our school more of a holistic approach, more whole school approach to mental health, because we were little pockets of support, but I wanted to see it more far reaching across the whole school and hopefully across the whole of the academy that I currently work for. Okay, next slide, please. So I'm going to talk today about my exploration of my journey towards completing my master's degree, which I completed last year. So it's quite recent. And how this had a significant impact on my professional and my personal development. Next slide, please. So as I said, I work as part of a multi-academy trust that includes primary and secondary schools. I said I have a variety of roles, as you can see, but I find that's really beneficial for me and for the families I work with, because I think the majority of families that I talk to, I've supported them in a number of ways within one of my roles. So I think the head would agree with me if he was here that I probably know more about some of the families in the school than anybody, because I work with the majority of them across my different roles. Next slide, please. So, like I said, my journey began. I identified a gap in the school provision. Like I said, I started as the ELSA practitioner, and then I worked alongside my Senko at the time. And we noticed that lots of people were doing little pockets of things, but there was no real joined up working. I also noticed that we were offering support in school, but when we were looking at outside agencies, the children that we were working with didn't always meet their threshold. So we would, the little few children that were not getting the support that they needed. And I wanted to explore why that was and if the school could sort of fill those gaps. We had an increasing number of children presenting with mental health needs, primarily anxiety, depression. And again, it was down to me at the time as ELSA practitioner to try and support these children. This is before the mental health support teams are even embedded in schools. So it literally did fall on our school. And that was a tough thing to carry on your own with no support. It was really hard. I noticed that staff lacked confidence in how to respond to mental health needs. They had limited training, limited strategic direction for mental health support across the academy. And I strongly felt, and do strongly feel, that we can do better and offer the children more that we work with. And I felt that gap could be filled with the right knowledge and skills. Next slide, please. So why did I choose this pathway? I came across the program, the Masters. It was actually advertised on Facebook, and I thought, oh, this is the exact program that I need. It offered me flexibility. I could do it online with the right support. It combined the academic rigor and the ways I could practically embed this in the school. It focused on the whole school approach that I was looking for. And it provided a framework for strategic leadership. And it completely aligned with my values and evidence-informed practice. So it ticked every single box. The course enabled me to explore the social economic factors influencing children's mental health. So I think as schools, and I've said this in another recent talk that I did, that we're very good at understanding the children while they're in school. We understand what their lived experiences whilst they're in school, but what affects them outside of school, I didn't think we were always very good at understanding those different sort of influences. The role of multi-agency collaboration. Again, I think before we sort of worked quite insular. We didn't reach out as much as we could to other professionals. And I think other professionals sometimes struggle to come into schools. I think that that relationship wasn't always there. I think because we all work in different ways, so I was trying to bridge that gap, which I think we have done really successfully, and I'll come on to that later. We were using evidence-based interventions, but actually I don't think we'd ever questioned if they were the right ones for the children that we work with. And my master's really opened my eyes that actually, yes, there are a number of other interventions that we could be using, and we don't always have to use the same intervention. So that was really interesting for us to explore that further. I was able to look at how the school could create a more mentally healthy environment. So for our school, we used to be such a colourful school, and we've now muted colours. It's more of a calming experience. Everybody that walks into school says it's much more calmer. The children respond better. We've got five spaces within the library for children to go and talk to other children around their mental health. So we've set up mental health champions. We're reducing the stigma around the mental health for children, and that's through lots of conversations. We've got digital ambassadors that now produce a termly podcast around mental health, which is absolutely amazing. So that's my year 5s and 6s who run that now. So it's every term. I think last term we did the impact of racism on children's mental health and how that can affect children in our local community. Anti-bullying campaigns, they run with it with my support, and it's been really beneficial. And it's been an opportunity for us to evaluate our own school offer. Again, it's been really interesting for me to go to the senior leadership team and say, we could be offering more, let's have a look at it together. So that's now embedded as part of our SICK meetings, that we look at what we offer the children for the mental health. Next slide, please. Like I said, we evaluated our school approach. Myself and the SENCO at the time went away and we looked at the existing interventions. I felt we could be offering more, so I now offer the drawing and talking and the sand tray therapy sessions for the children, because at the time we're only offering ELSA, and that didn't suit every child that I work with, especially those children that were experiencing trauma. So I wanted to be able to offer a little bit more. We now offer, what else do we offer? Sorry, my mind's gone blank. We do offer a lot more interventions across the board. We've shifted to targeted purposeful support. We've identified gaps and inconsistencies, and we've developed clear pathways for children and families. So I now have a graduated approach to mental health support within our school, I insist before anything comes my way that the teachers try and do some low-level interventions in the classroom with my support of what that could look like. That takes some of the pressure off of myself and my team. And then it's tier 1 would be the ELSA super interventions and therapies, moving on then to drawing and talking and my sand tray therapy, before we then move on to outside professionals. So it's that clear, direct route, because I think before a lot of people say, oh, they need a referral. And like we know, I could refer to cancer that's never going to meet threshold. So it's all about starting that intervention a lot sooner as well, supporting staff to recognise those early indicators that a child is struggling. So I also now do staff workshops. I do them with TAs, I do them with teachers, and that's increased staff knowledge and confidence across the board now, where staff are more confident and more able to talk about mental health needs. Again, they were concerned they were going to get it wrong. And I think mental health is always that, oh, I'm not sure, I don't know. But now they're more confident to actually say, actually, could you come in? Could you help me? Could you come and observe this child with me? I think that, we're experiencing maybe on the verge of EBSA. I need some support. So working together, I'm working more with the teachers, whereas before I was working more insular on my own, isolated. I'm now getting teachers to approach me and I'm able to support them more effectively. So that's had a huge impact. Next slide, please. So the impact on children and families within the school is that we have stronger relationships. I can be approached now in the playground, and parents say, I'm really struggling with my child and not wanting to come into school, or we're having anxiety before school, or my child is really anxious with friendships, and so I'm having those good communication now. We're not waiting for crisis point. They're coming to me a lot sooner, and that's really helpful for us. The interventions we offer are more needs led. We're able to identify those children. We're able to ensure they're getting the right therapy and support, rather than just offering the one. We're able to say, actually, this is more appropriate. We can try this, and therefore these children are getting more effective support. More increased emotional safety for children. I think part of that is also having our mental health champions on board. My mental health champions, they are trained. We train them, just like previous speaker. I think we train them from September to Christmas. They give up their lunch times. They volunteer, and every one of them, I trained 30 last year. Every one of them gave up their lunch times for that whole period to train as a mental health champion. Just not looking at how they can support other children, but specifically looking at their own mental health, which is really important for some of our children, because it made them realise they weren't on their own, and that empowered them of, actually, I'm not on my own. I can pass on my experience. I can support other children. So I have 30 mental health champions. They're based in the playground. They're based in Key Stage 1 library and Key Stage 2 library, and children are more confident sometimes to go and approach a peer than they are a member of staff, especially in a busy playground. So that's been really effective, and children really benefited from that. And I said my digital ambassadors are just amazing with their podcasts that they're currently producing. There's great confidence from parents in our support. That's been fed back. They really appreciate the workshops now. We offer them within school time and outside of school. I've got one next term. It was slow to start. I had about 3 or 4 parents, but actually now I think I've got 20 signed up for my next workshop, which is huge. And again, it's I think it's having parents having that sort of confidence now to say, actually, I'm not on my own. I'm not on my own, and that's been passed through from other parents that have attended the workshops, and they found it really helpful. More consistent communication and guidance, and a clearer, more accessible offer for families. Next slide, please. So for myself personally, I am not the person who started the master's course way back when. The person who probably started the master's way back when, I'm going to be honest with you, the first time I did a presentation for my master's, I think Claire will tell you, I was physically sick with fear. And here I am today. So I have personally come an awful long way. My confidence is through the roof. I'm confidently discussing our school's mental health offer with external professionals now. We are part of the Cradle to Career programme, and I'm now co-running that with my head and other members of the academy. And that means I have to talk professionally about what we offer as a school, and that includes my mental health offer, which is amazing. So recently I'm now working with a local university, and that we are offering student placements based around what we currently offer in school, which is amazing. So that starts in September. I'm leading conversations with SLT and the Trust. I'm supporting staff to build confidence and understanding. I'm delivering training across the school. And I'm regularly speaking to students about their own professional journeys. I've done some coaching for staff as part of my master's, and that was so helpful for the staff and for myself. And that was a bridge, again, that gap between teachers and SLT, of having those conversations. And that's been really beneficial, because again, staff, I'm removed from being SLT, and they sometimes find it more comfortable to speak to me. So that's been absolutely amazing. That's been a bit of a journey, I think, for us as a school. And next one. So whole school's achievements. We have been awarded 2 school mental health awards, which is amazing. I was nominated for the Educators Trust Award, which is a huge honour. It strengthened our reputation as a school committed to mental health and inclusion. And we now have clearer systems, improved consistency, and stronger outcomes for children. I think that's my last slide. Oh, personal growth. An increased self-belief and professional identity. Like I said, my confidence is absolutely, I'm a different person to who started the master's course. I've got great clarity in my leadership approach. I've got a deeper understanding of trauma-informed practice, a renewed passion for improving outcomes for vulnerable children, and a sense of purpose and direction in my career. So I am just about to undertake another postgraduate degree. I said I'd never study again, but here we are. And that is a safeguarding postgraduate degree. And my whole view on that would be mental health and how that impacts other areas of safeguarding across the school. So looking ahead, we're embedding the whole school approach, embedding a whole school mental health strategy. We're strengthening our multi-agency partnerships, like I explained, with the university and other partnerships. We're expanding staff training and development. We're continuing to refine interventions and pathways, and I'm using my learning to influence a wider practice across the trust. Thank you.